Today we are looking at asthma and the effects of steroid inhalers on the voice. Dylan Vance and Robert T. Sadaloff looked at the effects of inhaled corticosteroids on the voice when used to treat asthma in the November-December 2023 edition of the Journal of Singing. Asthma is an extremely common chronic respiratory condition that affects around 25 million Americans. Asthma presents with inflammation of the airways, wheezing, chest tightness, shortness of breath, and coughing. A common physician-prescribed treatment for asthma is an inhaler with corticosteroids, ICS. Many studies have been conducted on the effects of inhaled corticosteroids on the voice since Williams et al. In 1983. Across the studies, researchers found dysphonia, voice disturbance, in up to 50% of asthmatics using inhaled corticosteroids. Laryngeal stroboscopy of affected individuals found bowing of the vocal folds, impaired closure of the vocal folds, vocal fold edge irregularities, vascular lesions, mucosal thickening, and more. A 2004 study by Roland, Bala, and Eris found that the risk increased with higher doses, adding increased bruising, hoarseness, and pharyngeal discomfort to the potential symptoms. Studies have found a 5 times greater risk of dysphonia for metered dose inhalers and a 3 times greater risk for dry powdered inhalers as compared to a placebo. Vance and Sadaloff also noted that there are studies that show inhaled steroids can improve voice quality for asthmatic singers by enhancing the power source of the voice. There also appears to be a case for smaller particle size to lessen the effects of the corticosteroids on the vocal mechanism. Vance and Sadaloff conclude that inhaled corticosteroids used to treat asthma can have negative impacts on the voice, including changes in vocal quality and atrophy. Teachers, singers, and parents should be aware of asthma treatments and should ensure their pulmonologist understands voice issues and has prescribed the optimal medication. To read this exceptional article, check out Volume 80, Number 2 of the Journal of Singing.